evening, everybody. So for tonight's live stream, I've got Dr. Polly Baker with me, and Polly is a consultant in sports and exercise medicine, and I've worked with her for several years. So I wanted to get her on to explain to you guys what she does, how you can benefit from seeing her, and yeah, I'll let it over to Polly. So Polly, if you want to tell us a bit about your background and how you got interested in sports and exercise medicine.
No problem. Thanks for having me, Marika. So originally I trained in emergency medicine, but always loved the idea of sports medicine. But at that point, there was no training scheme. Eventually, in 2008, I went onto the London training scheme. There was a variety of them existing over the country, and did my training, becoming a consultant in 2012. And then since then, I've worked in a variety of settings, including elite sports. I've worked with rugby clubs. I've worked at the London 2012 Olympics. I've worked in the military, at Headley Court, and also in the private setting where we've obviously worked together, which has been great, obviously. I was originally drawn to sport and exercise medicine because it combines two loves of mine, which is medicine and sport, and I've done a lot of sport growing up. But what was quite interesting when I started the training was that I sort of realised that it wasn't just sports people that I was treating, and actually the other sort of large part of my caseload, which was treating people with musculoskeletal problems, so bad backs, bad shoulders, bad knees, was a lot of what I enjoyed as well. So yes, it's been great because I treat people of all ages, all manners of activities, and my focus is trying to get them back to what they want to do, which is very, very rewarding.
Okay, so is it safe to say that actually instead of the sports people or just sports people, it's active people, it's anybody who wants to do something, even if it's just walking their dog?
Yeah, it's any activity someone wants to get back to. So it could be an elderly gentleman who's injured his back during gardening. It could be a 12-year-old gymnast who has done too much and has got some growing pains related to it. It's literally anyone that has a problem with their musculoskeletal system that wants to get back to something and they're currently unable to do it.
Okay, so tell us how do you get them back to what they want to do?
Well, I work very closely with a multidisciplinary team, including physiotherapists, podiatrists, and so on. But essentially, I see them, I take a history, I examine them, I come up with my idea of what's going on, so a diagnosis, and then if appropriate, I'll investigate and come up with a treatment plan.
Okay, so what investigations are you talking about?
So there's a variety of different investigations we use for musculoskeletal problems. The commonest would be MR imaging or ultrasound scanning. And what's really nice is that I've got a qualification in ultrasound, and a lot of fellow sport and exercise medicines do too. So we can actually provide that service within the consultation. So it's a very good modality for looking at soft tissue structures, so muscles, tendons, and so on. And you can actually see the images there and then in the appointment, just like you can see a baby when you go and have your pregnancy scan. You can see the problem straight away, and that's really nice to explain to patients with the image.
So just to be clear, are we saying a baby is a problem?
Depends on the day that you have them, I think.
Okay, so yes, and I think that's the feedback that I get from my patients as well, is that they love the fact that they can go in and see you and you can actually scan the shoulder, give them a proper definitive diagnosis on the day, and then really triage the treatment to what they really need. Is it an injection? Is it exercise? So tell me about the ultrasound scanning. What can that be used for?
So as well as obviously coming up with a diagnosis or working out what the problem is, you can also use ultrasound to guide injections, which is sort of part of my toolbox of treating someone with a musculoskeletal problem. Now, I certainly don't use that as first line. If people are able to respond to it, exercises, I will leave that as a sort of second line or a backup if they don't get better. But with ultrasound, you essentially can see the needle go directly into the place that you want. And in certain conditions, for example, I think a lot of people may have heard of shoulder impingement, the area that you're trying to inject is very, very small. So seeing that needle go into that place is fantastic, because you know if it works, that's exactly the right diagnosis.
Yeah, and I guess I've also had quite a few patients where they've had injections in their GP practice where they've injected just blindly into the shoulder and they've not worked. And then I've sent them to you guys, and then the injection actually works because you're putting it right where it's needed.
Yeah, exactly. And what's really nice as well with the injection, and which really helps the patient, is as well as putting in what you normally put in, which is corticosteroid, you put in some local anaesthetic.
Mm-hmm.
Now, the steroid will take about a week to work, but the local anaesthetic can take away the pain straight away. So what you can do is you can do the injection, examine them before and recreate their pain, examine them afterwards, and their pain's gone away. And that gives the patient a lot of confidence. And what
Mm-hmm.
I find is a lot of patients that come to see me, unfortunately, have been treated for quite a while, and I'm sort of almost like their last resort. So having that
Yeah.
confidence that I found that spot really supports them in the rest of their management and treatment, which is great to see.
So that actually takes me on to an important point. So normally you mentioned that you're the last resort where people have seen everybody else and they finally come to see you. At
Yes.
what point do people actually need to come and see you?
So I think it depends on the person that you're treating. So, for example, if I was working with my Premiership rugby team and they need to be back on the pitch straight away, it's useful to have many hands on deck to give an opinion.
Mm-hmm.
I think essentially, though, the ideal situation is that you're working closely with a physiotherapy team and that it is cases that they're finding hard to manage,
Mm-hmm.
either because you need to have some type of imaging to confirm a diagnosis, or they're finding it hard to manage because there's a lot of additional problems, for example, other medical problems like diabetes or psychosocial issues like depression, which it can really help because we've got that breadth of experience of dealing with it. The other cases I would recommend is if you've tried a period of rehabilitation which is entirely appropriate for condition,
Mm-hmm.
and you get to the end and you're like, actually, they're not better, we can then obviously give an injection to facilitate that rehab. The rehab is always the way forward, but that injection can sometimes facilitate and just take away those pain fibers which are preventing the patient to move on.
Now, while we're on that subject of injections, what other things do you have to offer?
Well, I've got a lot of things to offer injection-wise.
In sports and exercise medicine.
Yeah, well, injection-wise, I have a lot to offer. I mean, in terms of shoulders, I could start with that. We obviously do injection for impingement that I've already mentioned.
Mm-hmm.
We do a good procedure, well, a fantastic procedure for shoulder, frozen shoulder, which actually dilates and stretches the capsule, which is the tight structure in frozen shoulder.
Mm-hmm.
We do injections for osteoarthritis, both steroid and something called hyaluronic acid, which is a synthetic joint fluid.
Mm-hmm.
And I'm also able to do ultrasound guided epidurals for sciatica and leg related problems related to the back. Finally, I think the other sort of tool in my toolbox is injections for tendon problems. Again, it's sort of a last resort if you're not responding, but sometimes they can be very useful if pain is an issue in progressing with rehab.
Okay, so the other question that I get often is, how are you different from an orthopedic surgeon or consultant or even a physio? Because you've mentioned exercise, you've mentioned all of the things that kind of sounds as if it's part of those genres.
No, absolutely, and there is an overlap. I think what we bring to the table compared to an orthopod, for example, is that we will look at the shoulder in the context of the whole individual. So is there a problem with the lower back which is causing them to overload that shoulder? We're also able to provide that diagnostic imaging, which a lot of orthopods are unable to do, and we liaise and work much more closely with a multidisciplinary team than, for example, an orthopod does. The other main difference is that we don't operate, which I should have probably said at the beginning. And we use non-operative methods of getting someone better. And actually, the really great thing is that works in, I think the quote is 85% of musculoskeletal problems.
Okay.
So that's great. Then in terms of differences with a physiotherapist, again, there is an overlap, but we have that medical background. So other medical issues we can deal with and address. We also obviously prescribe medications which can sometimes be very useful, particularly in things like back pain and chronic pain. So there's an overlap, but We're unique.
I think from my own experience as a physio, the thing that makes it really nice for me to work with you guys is the fact that you actually really understand muscles, muscle function, and rehab,
Yeah.
because that's a big gap when when my patients see other consultants who deal with the musculoskeletal system, but maybe aren't that up to date with exercise and things. And I guess because you guys, if you're working with your rugby team, you can't really send them for surgery every now and again. You want to get them better as quickly as possible. So I
Absolutely.
would say that's from my side one of the big things. Now, a question has come in. Mr. Glenn Foley is watching. He's a podiatrist friend of
Okay.
ours. Glenn's saying, what about ankle injections?
Well, I do ankle injections. So the two sort of commonest would be either a steroid injection for synovitis, and synovitis, just to explain to those non-medics out there, is when the capsule of the joint is inflamed and irritated, which you can quite often see when you've got an unstable ankle from a chronic or recurrent ankle sprains. Also do the synthetic joint fluid injections for osteoarthritis, and then I can do guided injections for any tendon issues around that joint as well. So
just tell us a little bit about the synthetic injections for the osteoarthritis. You mentioned it for the knee as well as the ankle. What does that actually do?
So it's probably easier if I tell you how a healthy joint works first, to explain how the synthetic joint fluid works. Essentially, the healthy joint works by every time it moves, the joint fluid, which contains nutrients and is also viscoelastic, so a bit like a WD-40, it's got some shock absorbency properties. When a healthy joint is working, it uses that to keep the joint healthy and to provide some shock absorbency. When you get osteoarthritis, the substance that is produced is no longer very effective. It's thin, it's watery, it doesn't really do the job. The synthetic joint fluid then replaces it, essentially, and re-provides you with that ability to do those functions. It does also have some anti-inflammatory properties, which work similarly to if you have a steroid injection, but it has that sort of long-lasting effect. And the positive is that it doesn't have those negative side effects of steroids that everyone sort of hears about as well.
The big thing is, I know where to find you because you're in Sussex, close to me. But if I am in another part of the UK, how do I go about finding a sports physician? How do you guys, or sports and exercise medicine specialist, how do I search for that?
Yeah, it's a tough one because we're not really available freely within the NHS. So there are some sports physicians within the NHS, but it's knowing where they are. I think your best bet, if you're privately insured, is to specifically ask, is there a sport and exercise medicine doctor close to me? And your insurance provider should be able to find out that. I mean, other options are to have a sort of a record of some, for example, like myself on Twitter, and send me a message and I can help you with it. But it is quite tricky because we are relatively few and far between, but we are growing as a specialty. And so I think if you approach your local private hospital, you may be able to find us that way.
Okay, cool. So, Polly, is there anything else that you wanted to share tonight?
Not that I can think of.
Excellent. So if anybody wanted to find you, where can they find you?
So currently I'm working for the military, so you'd have to be a serviceman or woman, and that's it near Loughborough, but we're opening it up soon. It's going to be a national rehabilitation centre for the NHS, so hopefully I will be able to start seeing people there. Otherwise, wonderful. Privately, I now work at the Spire, Tunbridge Wells. I've just started a clinic there, and I would be more than happy to see you, and I have all my ultrasound and injection availability there as well, so that's great.
Wonderful. And how can people find you on social media? What's your preferred?
So I'm trying to get into Twitter. I'm doing my best, and I'm at Dr. Polly Baker. So please do contact me there. That's the best way to get hold of me.
Thank you for watching. If you would like to learn more about preventing sports injuries, make sure you hit the subscribe button. See you next time.